So sorry for the inconvenience, everyone. We are starting the webinar now. Thank you for staying connected. Namaste, Sat Shri Akal, Salamu Alaikum, and a very fresh good evening, everyone. This is Sanghamitra, leading the care management team at Xyla Health, and I'm your host for today. So to start with, and for a quick introduction, Xyla Health is India's leading AI-powered health management platform that is serving 2 lakh plus patients in 595 plus cities and happens to be the highest rated app with a 4.8 plus rating and delivers 24/7 care. We have been helping people with multiple health conditions such as COVID, diabetes, heart issues, kidney health issues, and women's health issues through a very able and experienced team that is in-house at Xyla for the highest quality care. So as you all know, hypertension or high blood pressure is one of the most common health-related problems across the globe now. Hence, there are several misconceptions that need to be addressed so that we can effectively manage it. So here we are today on the occasion of World Hypertension Day to understand what are those myths and what are the real facts related to hypertension and its management. So we have with us Dr. Gunjit Madan, who is a general physician. She has previously worked at JJ Hospital and currently providing her services in patient care at Xyla. Thank you so much, Dr. Gunjit, for coming on this platform. We are very delighted to have you among us today and looking forward to this insightful, informative webinar with you. Requesting
Thank
everyone
you for having me, Sangha.
Thank you so much, Dr. Gunjit. So looking forward to this webinar, requesting everyone that you can start sharing your questions in the chat box, which will be answered towards the end of the session today. Over to you, Dr. Gunjit.
All right. Okay. So today we're going to take a very close look at what hypertension is. And our hope that is towards the end of the webinar, आपके जो भी सारे doubts है hypertension या high blood pressure को लेके, वो you come out with a clearer idea and you have a better idea of what exactly the disease is and what you can do to deal with it or prevent it from developing later on. ठीक है? Next slide. Okay, let's start the presentation. So what exactly is hypertension? Most people know that hypertension is high blood pressure, but what does it mean when you have high blood pressure? The technical definition is when there is increased pressure exerted by our blood on our vessel walls. हमारी जो blood है वो हमारी arteries और veins में flow करके it supplies, that's how the blood is supplied to our whole body. Our heart pumps blood through our arteries and veins, and that normally exerts a pressure, एक lateral pressure walls पे exert करता है. Sorry. जब ये blood pressure बढ़ जाता है, then we call it hypertension or high blood pressure. And if you've ever taken your blood pressure reading, you'll see that there are 2 readings. Generally, we have slash करके 2 readings आपको दिए जाते हैं. So the first one in that is known as systolic blood pressure, and that is the pressure in your arteries or your blood vessels when the heart beats. When the heart is pumping, that is your systolic blood pressure. और जो नीचे रहता है, slash के नीचे रहता है, that is called a diastolic blood pressure, and that is the pressure in the arteries between heartbeats. Sorry, I have a slight track off. Please bear with me. ठीक है, next slide. So what are the risk factors for developing hypertension? In India, we get a lot of hypertensive patients. बहुत patients हैं जिनका blood pressure काफी high रहता है. So आपको अगर assess करना है कि am I at risk of developing hypertension later down the line, how will you assess that risk? So the most common risk factors are age. Generally, with increasing age above 40 years of age, we start seeing patients develop high blood pressure. But there is now a lot of research that shows that some children can also have it, in teenagers also, because of stress. Sometimes high blood pressure can occur. All right. But generally, age is very important, and with increasing age, generally it is seen in people who are older. So above the age of 40 is when we start seeing patients who come with new onset, or people who are newly diagnosed, जिनका diagnosis पहली बार हो रहा है hypertension का. ठीक है, the next thing that we look at is family history. Now, family history is very important. अगर आपके parents को either of them have hypertension, there is a strong possibility कि आपको भी high blood pressure develop हो सकता है. So it's very important to keep age, family history, sex, and by sex I mean your gender. So if you're male or female, generally males may hypertension develops at a younger age up to menopause, and then after menopause that risk factor equalizes. So these are the non-modifiable risk factors, है ना? ये risk factors आप change नहीं कर सकते. आप अपना age नहीं change कर सकते हो, आप अपनी family history नहीं change कर सकते हो, आप अपनी जो gender है वो change नहीं कर सकते हो. So these are what we call non-modifiable risk factors for hypertension. On the other hand, when you look at modifiable risk factors, we are looking at things like weight. जब आपका BMI बहुत high है, तो chances of developing hypertension is high. अगर आपका बहुत sedentary lifestyle है, you don't walk, आपकी job ऐसी है that you are sitting for long hours of the day and you come back and you're tired, you're not able to exercise regularly, so you have a sedentary lifestyle, that means that you can develop hypertension later on in life. ठीक है? अगर आपकी diet में बहुत ज़्यादा salt है, what salt does is that it retains water, and our blood is made up of essentially water and a few formed elements. So it retains fluid in your vessels, and that increases blood pressure. So having a very high salt diet, अगर आपके खाने में salt बहुत ज़्यादा है, then again your blood pressure can increase. Smoking or chewing tobacco. Smoking is a very important risk factor because what smoking does is वो हमारी arteries को उनका size थोड़ा कम कर देता है, vasoconstrict कर देता है. That also causes an increase in blood pressure. So smoking is another risk factor for, if you have very long history of smoking, you can develop hypertension. और अगर आपका stress बहुत ज़्यादा है, nowadays we often see बहुत लोगों का या तो isolated एक reading बहुत high आएगा blood pressure का. If you're very stressed, your blood pressure tends to rise because your heart starts pumping faster, आपका adrenaline बढ़ जाता है, और उससे हमारा stress stress से adrenaline बढ़ के हमारा blood pressure बढ़ जाता है. और अगर आप बहुत chronically stressed रहते हैं, then that can also lead to hypertension, and it is seen now in younger adults who are less than 40, they start developing hypertension early because of these risk factors in addition to stress. ठीक है? All right, next slide. So how should you take your blood pressure? अगर आप घर पे BP माप रहे हैं तो कैसे लेना चाहिए? One, it's very important to make sure that you're sitting up straight. ऐसे नहीं है that you're in weird positions. Make sure that you're sitting straight, your back is well supported, and your feet are flat on the floor. ठीक है? Make sure that the arm that you're using to measure your blood pressure on, it's at the level of your heart. So the machine should be on a table और आपका हाथ ऐसे extended रहना चाहिए, and your hand should be flat, supported. ऐसा नहीं है that your hand is hanging off, off the side of the bed, or it's not well supported, because उससे blood pressure reading थोड़ी affect हो सकती है. Then you need to make sure that the cuff is the right size. Generally, you will not be able to, normal people, you're not able to judge the size of the cuff, but jo cuff aapko wo machine ke sath milegi, that's generally the right size. And you need to make sure that the cuff is above your elbow. Okay? And as much as possible, try to make sure that you're taking it without, you don't have any clothes or your sleeve is not under the cuff. So try to remove your sleeve up and then put the cuff directly on your arm to get the most accurate blood pressure reading. Okay? So things to remember is that it would be helpful if you're able to empty your bladder 5 minutes before. Make sure you haven't done any physical exercise, or you haven't smoked, or you haven't drank any caffeine 30 minutes to an hour before you are taking your blood pressure, because this can, affect your heart rate as well as your blood pressure reading. And as much as possible, try to measure your blood pressure at the same time every day. अगर आप log रख रहे हो और आप हर दिन उसी time पे blood pressure लेते हो, then it gives you some sort of consistency. While taking your reading, do not measure over your clothes. Measure daily for 2 weeks after a change in treatment. अगर आपके दवाइयों में कोई change है, अगर आपके डॉक्टर ने आपकी blood pressure medicine बढ़ा दी है या कम कर दी है, then try to measure your blood pressure every day for 2 weeks at the same time. And आप एक logbook अगर रख दोगे, then it's very helpful for your treating physician to look at the logbook and know whether the medicine is working or not. Try to avoid moving your hand while taking the reading. I know the cuff gets very tight and people have this tendency to wince and move their hand, but jitna ho sake agar aap, if you can stay still, it's very important for the reading. After taking the reading, what I generally suggest is try to take 2 or 3 readings और उसका जो average आता है, because sometimes you're tensed or you're anxious and that can alter the reading. So if you take 1 or 2 readings, 2 to 3 readings a minute apart, that's helpful, and you can get your baseline average reading. Okay, and always use a tracker. Nowadays there are many apps that have trackers for your vitals. If you are old school, then आप notebook में लिख सकते हो, whatever, it's preferable, but it helps to have a tracker so that you can see कि हाँ आपका blood pressure का trend कैसे चल रहा है. ठीक है, similarly keep a blood pressure journal to track progress. All right, okay, next slide. So आपको मैंने systolic और diastolic के बीच में I've explained the difference. Systolic is the blood pressure when your heart is beating, and diastolic is the blood pressure in your vessels when the heart is, so the heart beats and it stops. So there is like a small portion of your cardiac cycle where the heart is just still, the chambers are still, and that is the pressure in your vessels during that time is your diastolic blood pressure. अब अभी हम hypertension किसको बोलते हैं, कौन से readings को hypertensive readings बोलते हैं? तो stage 1 hypertension is when your systolic, जो ऊपर की reading है, अगर वो 130 to 139 के बीच में है और diastolic 80 to 89 के बीच में है, then that is known as stage 1 hypertension. And stage 2 hypertension, which is commonly जब आप डॉक्टर के पास जाएंगे, आपको दवाइयां स्टार्ट होंगी, that is greater than 140/90. So systolic is 140 and diastolic is 90. And stage 1 में generally, as far as I've seen and with my experience, it is possible, to manage with lifestyle changes. अगर आपकी age कम है और थोड़ा आपका reading 135/85 है, then the doctor will, give you some general advice, which we will see as we go further, on how to reduce your blood pressure. But once you cross that 140/90, generally medication start हो जाती हैं, taking into account your personal history and your family history. Okay, ठीक है, next slide. So what are the types of hypertension? A lot of people don't know that hypertension के दो types है. एक है प्राइमरी हाइपरटेंशन, जिसमें हमें पता नहीं है कि आपका ब्लड प्रेशर इतना हाई क्यों है. देयर इज नो एक्चुअल कॉज दैट वी कैन फाइंड. It is just, it could be because of your age, could be because of your lifestyle, but it is the primary cause of, there is no other disease that is causing your blood pressure to be high. ठीक है, so that is called primary hypertension, and ये सबसे ज्यादा common है. बट कुछ लोगों को सेकेंडरी हाइपरटेंशन हुआ है, अगर आपके किडनीज में इश्यू है, या आपको थायराइड का इश्यू है, या लेवल हाई है, या आपको स्लीप एपनिया है, देन इन दैट केस ये एक डिजीज है जिसकी वजह से आपका ब्लड प्रेशर हाई है, एंड इन दैट केस हम जनरली डिजीज को ट्रीट करेंगे तो आपका ब्लड प्रेशर भी कम हो सकता है. दैट इज नोन एज सेकेंडरी हाइपरटेंशन. ठीक है, नेक्स्ट स्लाइड. So what is white coat hypertension? Now this is very common, and doctors generally see when patients come, उनका blood pressure normal जो आप घर पे measure करेंगे उससे ज्यादा high clinic में आएगा. That is known as white coat hypertension. मतलब आप डॉक्टर को देख के, क्लिनिक को देख के, इतना फॉर्मल सेटिंग देख के आपका एंजाइटी बढ़ जाता है, और उससे ब्लड प्रेशर रीडिंग सिर्फ क्लिनिक में हाई आता है, बट घर पे जब आप मेजर करेंगे तो आपका ब्लड प्रेशर रीडिंग नॉर्मल रहेगा. तो दिस इज समथिंग विच इज नोन एज व्हाइट कोट हाइपरटेंशन. मतलब आप व्हाइट कोट या डॉक्टर को देख के आपका बीपी बढ़ जाता है, एंड इन दैट केस जनरली व्हाट डॉक्टर्स डू इज दैट दे ट्राई टू टॉक टू यू, आपको डिस्ट्रैक्ट करने की कोशिश करेंगे, सो दैट यू आर नॉट सो फोकस्ड ऑन द फैक्ट कि आपका बीपी मेजर कर रहे हैं हम. और उससे बहुत लोगों का 2-3 मिनट बात करके, थोड़ा उनको रिलैक्स करके 2-3 मिनट बाद अगर फिर से रीडिंग लेंगे तो वो बीपी यूजुअली नॉर्मल रीडिंग आ जाती है. ठीक है, ऑलराइट, नेक्स्ट स्लाइड. What are the symptoms of hypertension? Generally ऐसे कोई specific symptoms नहीं है. बहुत लोगों को high blood pressure सिर्फ अगर आप जनरल चेकअप के लिए गए हो और आपका ब्लड प्रेशर मापा है क्लिनिक में, तभी हाइपरटेंशन डायग्नोज होता है। बट अगर आपका बीपी बहुत हाई हो, देन दीज आर सम ऑफ द सिम्टम्स दैट यू कैन सी। जनरली बहुत पेशेंट्स सर दर्द का कंप्लेन हमें बताते हैं, उनको सुबह बहुत सिर में दर्द होता है, या सोने से उठने के टाइम बिल्कुल वेकिंग हेडेक बोलते हैं, जस्ट एज यू वेक अप आपको हेडेक होता है, या चक्कर आता है, या आपको ठीक से दिखाई नहीं देता है, ब्लर्ड विजन है। these three are very common causes of very common symptoms of hypertension which are commonly reported to us, ठीक है। और कुछ लोगों का अगर ब्लड प्रेशर बहुत हाई होता है तो एपिस्टैक्सिस इज व्हेन देयर इज ब्लीडिंग फ्रॉम द नोज, तो नोज, कुछ लोगों का नोज ब्लीड हो जाते हैं, कुछ लोगों को palpitations हो जाते हैं, मतलब दे कैन हियर देयर ओन हार्ट बीट, एंड कुछ लोगों को सोने में तकलीफ होती है, ठीक है। बट दीज आर वेरी नॉन स्पेसिफिक सिम्टम्स, और बहुत लोगों को ऐसा भी है कि कोई सिम्टम्स नहीं है और फिर भी वो लोग हाई ब्लड प्रेशर से डायग्नोज होते हैं, ठीक है। नेक्स्ट स्लाइड। तो आपको ब्लड प्रेशर डायग्नोज हो गया है, बट आपको ये नहीं, और आप दवाई ले रहे हो, बट what is truly the effect of having blood pressure for a long period of time, high blood pressure for a long period of time? So let's see what are the effects on various systems of your body अगर आपका blood pressure high रहता है। तो लॉन्ग स्टैंडिंग हाइपरटेंशन का मतलब है कि बहुत सालों से आपका ब्लड प्रेशर हाई है, तो बॉडी के वेरियस सिस्टम्स पे क्या इफेक्ट होता है, आपके हार्ट पे क्या हो सकता है, द समथिंग कॉल्ड हाइपरट्रोफिक कार्डियोमायोपैथी। ये जनरली यंगर पेशेंट्स में रहता है, फैमिली हिस्ट्री रहता है, एंड हार्ट का साइज और मसल वॉल्स थोड़े थिक हो जाते हैं, ठीक है। सो दैट कैन हैपन, बट नॉर्मली there is something known as hypertrophy of the heart walls, जो long standing hypertrophy रहता है, जो older patients में रहता है। और ये क्या, the best way to explain it is कि आपका heart, आप ऐसे समझो कि जब blood pressure high है, then the heart has to pump harder and harder। जब वो इतना हार्ड पंप कर रहा है तो उसके वॉल्स थिक हो जाते हैं, एंड दैट इज नोन एज हाइपरट्रोफी, और उससे हार्ट वॉल्स को ठीक से ब्लड नहीं मिलता है, हार्ट अटैक के चांसेस बढ़ जाते हैं। सो कोरोनरी आर्टरी डिजीज विद एमआई, दैट्स सीएडी विद एमआई, हार्ट अटैक्स हो सकते हैं, हार्ट फेलियर हो सकता है, एंड बहुत लोगों को अथेरोस्क्लेरोसिस इज ऑल्सो वेरी कॉमन इफेक्ट ऑफ लॉन्ग स्टैंडिंग हाइपरटेंशन। नाउ दिस इज, ये जो डायग्राम आप देख रहे हो, क्या होता है कि हमारी बॉडी में अगर हमारे कोलेस्ट्रॉल लेवल्स हाई है तो ये कोलेस्ट्रॉल हमारी वेसल वॉल्स में जाके डिपॉजिट हो जाता है, एंड उससे वेसल, जो ब्लड वेसल का जो सर्कमफ्रेंस है वो कम हो जाता है, छोटा हो जाता है, जिससे ब्लड प्रेशर बढ़ जाता है। That is known as atherosclerosis. And atrial fibrillation is a type of arrhythmia, जब आपकी हार्ट को ठीक से ब्लड नहीं मिल रहा है तो कभी कभी कुछ लोगों को atrial fibrillation हो जाता है, ठीक है। किडनीज को अगर देखें तो बहुत लोगों को क्रॉनिक किडनी डिजीज हो जाता है। आपकी किडनीज जो जो उनका नॉर्मल फंक्शन है, विच इज टू फिल्टर ब्लड एंड प्योरीफाई द ब्लड, वो ठीक से नहीं होता है। हाइपरटेंसिव नेफ्रोस्क्लेरोसिस हो जाता है, जिसमें जो किडनी के जो ब्लड वेसल्स है वो डैमेज हो जाते हैं। दैट इज समथिंग दैट हाई ब्लड प्रेशर कैन कॉज ओवर अ लॉन्ग पीरियड ऑफ टाइम, 10 to 15 years, ठीक है। द अदर वेरी दैट that normally अगर आपका ब्लड प्रेशर बहुत हाई हो जाता है, and that is why we like to make sure that our patients blood pressure is well controlled, is that अगर आपका ब्लड प्रेशर बहुत हाई है, chances of stroke increase, chances of things like memory loss increase. All right, so keeping blood pressure under target range is very important. और आंखों में हाइपरटेंसिव रेटिनोपैथी हो जाती है। आपका जो रेटिना का एक है, रेटिना इज अ लेयर एट द बैक ऑफ योर आई, and that can get damaged with high blood pressure, and it is a layer जहां बहुत blood vessels है। तो आपका blood pressure बहुत high है तो वो vessels भी under pressure आ जाते हैं, and it causes something called hypertensive retinopathy, ठीक है। So आपका blood pressure affects all, high blood pressure affects all systems of your body. आपके heart को affect करता है, आपकी kidneys को affect करता है, आपके brain को affect करता है, आपकी आंखों को affect करता है। तो इसीलिए अपना blood pressure regularly check करना, डॉक्टर से follow up रखना, दवाई ठीक से लेना, making sure that your dose is right for you. These are very important things because इसके जो long standing effects हैं, they can be quite, as you can see, they can be quite bad. ठीक है, next slide. सो अभी हम अपने जो वेबिनार के जो मेन टॉपिक है और जो हमें पेशेंट्स ऑफन पूछते हैं, वी आर गोइंग टू एड्रेस सम कॉमन मिथ्स। ये जो कॉमन जो पेशेंट्स को डाउट्स हैं और जो ये फॉल्स अजम्पशंस हैं अबाउट हाइपरटेंशन, वी विल एड्रेस ईच ऑफ देम एंड देन ब्रेक डाउन एंड टेल यू कि व्हाट इज एक्चुअली द केस। ठीक है, तो द मिथ हियर इज आई कैन नॉट प्रिवेंट हाइपरटेंशन बिकॉज आई हैव फैमिली हिस्ट्री ऑफ हाई ब्लड प्रेशर। बहुत लोगों को ऐसा लगता है कि अगर उनको फैमिली हिस्ट्री है हाई ब्लड प्रेशर की, तो उनको होने ही वाला है, हाई ब्लड प्रेशर होने ही वाला है, हाइपरटेंशन होने ही वाला है, उनको दवाइयां लेनी ही पड़ेंगी। बट दैट इज नॉट ट्रू। ठीक है, वाइल फैमिली हिस्ट्री ऑफ हाइपरटेंशन इज अ नॉन मॉडिफाइबल रिस्क फैक्टर, आप अगर अपने बाकी रिस्क फैक्टर्स को कंट्रोल कर सको, अगर आप अपना वेट कंट्रोल में रख सको, अपने डाइट को पे अटेंशन, इफ यू पे अटेंशन, मेक श्योर कि आपकी डाइट में ज्यादा सॉल्ट नहीं है, और अगर आप रेगुलरली एक्सरसाइज करते हैं, आपका जनरली जो दूसरा ब्लड वर्क है, आपका कोलेस्ट्रॉल लेवल्स कंट्रोल में है, आपकी डायबिटीज कंट्रोल में है, ऑल ऑफ दीज थिंग्स कैन help prevent the long term effects, and if you have hypertension it can also help prevent things like stroke and heart disease. ठीक है, so it is not necessary कि अगर आपको family history of hypertension है necessarily आपको hypertension develop होगा. You can control what is in your control is the modifiable risk factors like obesity, stress, sedentary lifestyle and salt in your diet. तो उस पे अगर आप focus करेंगे then it is completely possible to prevent developing hypertension. ठीक है, all right, next slide. If my blood pressure normalizes after taking medication, I can stop taking it. अगर मेरा blood pressure normal हो गया, मैं दवाई ले रहा हूँ 6 महीने के लिए और मेरा blood pressure अभी normal है, then I can stop my blood pressure medication. और ये बहुत लोग करते हैं. So many patients will stop their own blood pressure medicine because they are like, हाँ हमारा blood pressure अभी normal है, वो उस time high था, अभी तो ठीक है, we don't need to take our medication. Unfortunately, hypertension, high blood pressure is a lifelong condition. ऐसा नहीं है कि you get cured of it क्योंकि आपने 6 महीने दवाई ले ली. Okay, and this is very important. आप you can end up with very high blood pressure levels अगर आप खुद अपनी दवाई को adjust करने की कोशिश करेंगे या खुद रोकने की कोशिश करेंगे, and it can cause harmful issues. Some people develop stroke, some people can develop hypertensive retinopathy, some people can get heart attacks अगर उनका blood pressure control में नहीं है. So it's very important कि आप अपने डॉक्टर से रेगुलरली फॉलो अप कीजिए, अपनी दवाइयों पे अटेंशन, डोंट स्टॉप इट खुद से, या खुद डोज एडजस्ट करने की कोशिश मत कीजिए. बहुत लोग ऐसे हैं जो खुद अपने डोसेजेस कम करने की कोशिश करते हैं, ज्यादा करने की कोशिश करते हैं. अगर आपको कोई मेडिसिन सूट नहीं कर रही है, और ऐसा होता है, कुछ लोगों को सर्टेन मेडिकेशंस सूट नहीं करते हैं, उनको सम ऑफ द अदर साइड इफेक्ट है, please follow up with your doctor. It's okay to go to your doctor often and adjust your medication and follow up with them as often as you need to make sure that आपका जो medication regimen है is right for you. ठीक है, so like the slide says, hypertension requires lifelong monitoring, medications and regular follow-ups. Please avoid self-adjusting, stopping your medicines without consulting your treating physician. This is very, very, very important, and this is a thing that people do very often. वो अपनी thyroid medication खुद से बंद कर देते हैं, अपनी blood pressure medication खुद से बंद कर देते हैं, अपनी diabetes medication में adjustments करते हैं. It's very important that these conditions like hypertension, thyroid conditions, diabetes, these are lifelong conditions. Once you have them, it is very important कि आप अपनी medications time से लें और डॉक्टर से regular follow up रखें. ठीक है, all right, next slide. Young people don't have to worry about high blood pressure. So this is a very common myth. बहुत लोगों को लगता है कि blood pressure सिर्फ older individuals में होता है. अगर मेरी age 40 से ज्यादा है, so if I'm less than 40, I don't need to worry about blood pressure. ऐसा नहीं है. Because there is increasing evidence, there are a lot of clinical studies, and there are a lot of reports of patients who have high blood pressure readings in teens and young adults, so between 20 and 30 years of age, unko bhi high blood pressure readings or hypertension develop ho sakta hai. And the reason for that is nowadays hamari diets काफी unhealthy है. बहुत से लोग घर का खाना नहीं खा पाते हैं, बाहर से खाना ऑर्डर करते हैं. You cannot control the salt if you are not cooking your own food, or if you're eating food that comes out of a packet. तो at that time, you know, आपका salt बढ़ गया, आपका स्ट्रेस तो वैसे भी बहुत ज्यादा है, आपका वेट कंट्रोल में नहीं है, आपका वैसे बाकी का ब्लड वर्क कंट्रोल में नहीं है, आपको एथेरोस्क्लेरोसिस है ऑलरेडी, यू नो, एंड लॉट ऑफ पीपल नाउ हैव फैटी लिवर, एथेरोस्क्लेरोसिस from younger ages because of a sedentary lifestyle, because of obesity, because of unhealthy diets, and this can all lead to hypertension. So it's very important to remain aware कि these are my risk factors, I eat outside or my weight is not in control. और अगर हम इन risk factors को, if we pay attention and act on them, अगर आप रोज exercise नहीं करते हैं and you're between the ages of 20 to 39, make sure that you exercise every day, make sure that आपका diet अच्छा है, salt control में है, बाहर का खाना आप कम खाते हैं, you know, and आपका stress reduction techniques, you have to take care of that in order to prevent you know, developing hypertension earlier than you should. ठीक है, next slide. If I add less salt to my diet, I can better control my blood pressure. Now this is true, but there is a few, you know, caveats to it. And क्या होता है कि हम सोचते हैं कि मैंने तो अपने खाने में सॉल्ट बहुत कम डाला है, या मेरे खाने में सॉल्ट बहुत कम है, मैं, you know, घर के खाने में हम सॉल्ट डालते ही नहीं है, फिर भी हमारा ब्लड प्रेशर इतना हाई क्यों है? Now there are some food items that we eat out of a packet, or you know, certain things that we eat जिसमें अगर आप food labels नहीं पढ़ते हैं, और हमारे जो भी हम खाना खाते हैं, even if you you know, unfortunately restaurant food doesn't have food labels, but if you are buying anything that comes out of a packet and is packaged and you're picking it up from a grocery store, तो food labels रहते हैं और उसमें sodium content रहता है. It's very important to make sure कि आपका daily sodium content is under 2500 milligrams. ठीक है? And बहुत लोग क्या करते हैं, वो you have Maggi noodles. If you ever look at a packet of Maggi and you see how much salt content is in it, it has around 1000 or 1100 milligrams of sodium. That's half your sodium intake for the day. And आपने फिर से, you know, अपना normal खाना खा लिया और आपने एक packet Maggi noodles, एक snack खा लिया, then you have already gone over your you know, it's possible you have gone over your sodium limit for the day, and that can lead to high blood pressure. So keeping track of the sodium, not only जो आप अपने खाने में डाल रहे हैं, but also in packaged and processed foods. So reading food labels on bread, on any snack foods, any chirwas, any namkeens, any noodles, anything that you are eating, any biscuits, all of them have hidden salt, hidden sugar. So making sure that you keep that in mind as well is very important. And usse agar aap, if you can avoid those foods, if you can stick to the food that you are cooking, even if you know, if you can find alternatives, then you can cut the excess sodium in your diet, and that can reduce your blood pressure. ठीक है? Next slide. So early detection of hypertension. हम what steps can you take to make sure कि आपका hypertension early detect हो? Okay, since hypertension is asymptomatic, क्या होता है कि बहुत लोगों को पता नहीं चलता है कि उनका blood pressure high है. ठीक है? You may have headaches, आपको शायद दिखने में कुछ problems हो, and generally at that time what doctors will do is they will check your eyes and they will check your blood pressure. Those are the two most common causes of headaches and blurry vision. ठीक है? Or you're not drinking enough water. So what they will do is आप making sure that आप इन complaints को, अगर आपको कोई symptoms है, you don't ignore that, and even generally you go to a doctor, आप एक physical exam कराओ, एक general health checkup, you know, regularly कराएंगे, so you can stay on top of this. So even if you are, say, you know, आपको hypertension नहीं है, but your doctor is slightly worried कि आपका blood pressure थोड़ा सा high है, these are the things you can do, then आप वो early, you know, you will introduce those habits early, and you can prevent developing hypertension later down the line. ठीक है? So for early detection of hypertension, since hypertension is asymptomatic, मतलब ज्यादा कोई symptoms है नहीं, कोई ऐसे कोई खतरनाक symptoms ऐसे नहीं आते हैं, regular screening is very important. मतलब आप अपने डॉक्टर के पास जाएं और अपना ब्लड प्रेशर क्लिनिक में आपका एक बार ब्लड प्रेशर माप, and that is necessary to prevent end organ damage. So end organ damage is your end organs are your kidneys, your blood vessels, your heart, your brain. So these are all organs which are, supplied by their own blood supply. And like we said, they have their own blood pressure से in systems पे effect होता है. So preventing long-term organ damage it's very important कि आप regular screenings कराएं. ठीक है, तो एनुअल स्क्रीनिंग मतलब आप साल में एक बार अपने डॉक्टर को विजिट करिए टू मेजर योर ब्लड प्रेशर. आइडियली अगर आप ऑलरेडी ब्लड प्रेशर मेडिकेशंस पे हैं देन यू गो एवरी 3 to 6 months, बट दिस इज फॉर अर्ली डिटेक्शन. सो इफ यू आर अबव द एज ऑफ 40 और आपको हाइपरटेंशन अभी डिटेक्ट नहीं हुआ है और यू डोंट हैव हाइपरटेंशन, इट इज you should still go see your doctor once a year at least if you're above the age of 40. If you're between the ages of 18 and 39, try to go every 3 years or at the maximum every 5 years. Try to see a doctor so that they can check your blood pressure and your general vitals and make sure that if there are any diseases that are in the early stages, we can catch them and prevent them. Okay, next slide. So what are the lifestyle changes? आप अपने लाइफ में क्या changes कर सकते हैं to prevent high blood pressure? So this is done in order of which is most effective to least effective. So the most effective way to reduce your risk of hypertension is weight loss. ठीक है, और अगर आप 1 kg कम करते हैं तो आपका 1 mmHg, तो आपका जो ब्लड प्रेशर रीडिंग रहता है सिस्टोलिक और डायस्टोलिक, दैट्स मेजर्ड इन मिलीमीटर्स ऑफ मर्क्यूरी. So every kg that you reduce, you are able to reduce 1 millimeter mercury from your systolic blood pressure. ठीक है, तो अगर आपका systolic blood pressure 135 है and you're 10 kgs overweight, you can make it 125 by reducing those 10 kgs over a long period of time. ठीक है, so weight loss is very effective in reducing your blood pressure reading, and we have given you the exact कि 1 mm of Hg per kg is possible. ठीक है, अगर आप अल्कोहल पीते हैं तो इन मेल्स इट्स रिकमेंडेड दैट ट्राई टू हैव sticking to less than 2 standard drinks a day, and in women less than 1 standard drink. So at the maximum you have 2 drinks a day, or in females 1 drink a day. If you are drinking very frequently and you can reduce it to those numbers, then you can reduce 4 mm of mercury of your systolic blood pressure. So agar aapka systolic blood pressure 135 है, 131 कर सकते हैं just by reducing your alcohol intake. ठीक है, keeping your dietary sodium below 1500 milligrams. This is very important. Reading food labels, accounting for salt जो हम खुद नहीं add करते हैं in snack foods, in other outside foods is also very important, and making sure कि आपके पूरे दिन में सिर्फ 1500 milligram sodium ही रहना चाहिए. That can help in reducing your blood pressure by 4 to 6 millimeters of mercury, and increasing your dietary potassium. So increasing potassium rich foods in your diet like bananas, citrus fruits, tomatoes, these are very good sources of dietary potassium, and increasing the potassium levels. एंड सो ये साइमल्टेनियसली होना चाहिए. आपका सोडियम कम होना चाहिए और आपका पोटेशियम थोड़ा सा बढ़ना चाहिए. Obviously within normal levels, 3.5 to 5 grams a day of potassium can reduce your systolic blood pressure by 4 to 6 millimeters of mercury. ठीक है, next slide. Exercise. Now having exercise is another very important way of reducing your blood pressure by 5 to 8 millimeters of mercury. So aerobic exercise, so and by that we mean cardio, so doing any sort of cycling, walking, jogging, running, all of these things which force your cardiovascular system to work harder. अगर आप between 90 and 150 minutes a week कर सकते हैं, so trying to do 30 minutes a day will push you at 30 times 7 is 210, and you've already hit that goal of कि आपका aerobic exercise is at a good place और आपका systolic blood pressure कम हो सकता है. But trying to at least do a minimum of 90 minutes a week or more than 150 is good, but between 90 and 150 we can reduce our systolic blood pressure between 5 to 8 millimeters of mercury. Strength training is another very important aspect. अगर आप weights resistance training कर सकते हैं, so using your own body weight as resistance training, or if you are able to lift weights, then that can also reduce your systolic blood pressure by 4 mm of mercury. So cardio exercises karna, weight lifting karna, smoking cessation, these are all very important ways कि आपका blood pressure कम हो सके. And हमने आपको exactly वो दिया है कि which activity affects your blood pressure by how much. And so weight loss is the most effective. followed by your salt intake, followed by your exercise and smoking cessation. ठीक है, आपका smoking cessation से क्या होता है? There is an ASCVD risk factor जो doctors calculate करते हैं, and that is your risk of atherosclerotic cardiovascular disease. It's a very long term. इसका बस यही मतलब है कि आपके हार्ट में blockages हो जाते हैं. तो to prevent those blockages, what can you do and what is your risk of developing blockages? And smoking को बंद करना पूरी तरह से, which is not easy, but smoking cessation reduces the risk of developing atherosclerotic cardiovascular disease later on. ठीक है, next slide. तो हाइपरटेंशन को जनरली कैसे ट्रीट करते हैं? एंड ऑब्वियसली दिस इज नॉट अ गाइडेंस. Please do not start any medication. This is just a general overview of how your doctors approach treating your high blood pressure. So generally, अगर कोई newly diagnosed case है, तो आपके जो डॉक्टर हैं, they will order blood test, they will ask your history, वो एक physical exam करेंगे, and then based on your various parameters, they will choose amongst the many classes of antihypertensive medicines that we have available. All right. So for most patients, what are we trying to do? For most patients, the goal of therapy is to try to keep our blood pressure reading below 130/80. ठीक है, आपका systolic 130 से कम रहना चाहिए, आपका diastolic 80 से कम रहना चाहिए. And that is where we are trying to reach. कि for the most part आपका medication अच्छे से काम करे और आपको long term organ damage ना हो और आपका blood pressure 130/80 से कम रहे. ठीक है, and generally आपको सिर्फ medications नहीं दिए जाएंगे, हम लोग lifestyle changes के लिए भी counsel करते हैं. ठीक है, अगर आपकी एज कम है और ब्लड प्रेशर 135/80 है, देन सिर्फ लाइफस्टाइल चेंजेस काउंसिल करेंगे. अगर आपका एज ओवर 40 है, ब्लड प्रेशर 140/90 है, तो आपको मेडिकेशंस भी मिलेंगे, लाइफस्टाइल चेंजेस भी काउंसिल किए जाएंगे. ठीक है, सो बेस्ड ऑन आपके केस पे डॉक्टर्स विल टेक द राइट कॉल एंड ईदर स्टार्ट मेडिकेशन और लाइफस्टाइल चेंजेस और बोथ. ठीक है, नेक्स्ट स्लाइड. So on the treatment of hypertension, what is very important कि आपको generally जब आपका शुरू में जब आपकी दवाई स्टार्ट होती है, तो your doctor can call you back in 1 month, or they can call you back in 2 months, or they can call you back in 3 months and ask you कि आप एक log रखो so that we can titrate the dose. By titrating dose means कि हम आपके dose को fix करते हैं based on how your blood pressure is over a month, 2 months, 3 months, and we can either increase or decrease the dose to hit that target of below 130, of keeping blood pressure lower than 130/80. So उससे हम follow up से, regularly counsel करने से, lifestyle changes से, और आपको monitor करके हम आपका dose titrate करते हैं. ठीक है, so dose will be titrated to suit the patient, and then regular follow-ups are recommended. Generally, follow-up recommended every 3 months, at the latest 6 months. Every 6 months, so definitely you should go to make sure that your medication, is working for you. There is no need to adjust the medication. There is no need to adjust, any other medication जो आप साथ में ले रहे हैं. और एक overall assessment करने के लिए हर 3 से 6 महीने follow up रखना with your doctor is very important. So whether you do that with your cardiologist or your internal medicine specialist, whoever you are comfortable with, please make sure कि आप अपने high blood pressure के लिए follow regularly रखें. So between 3 to 6 months. And another parameter that your doctors will monitor every 3 to 6 months is something known as your serum electrolytes, जिसमें आपका sodium level, potassium level, chloride level, ये सब हम देख सकते हैं. We can see that if your sodium level is too high, आपका potassium बहुत high है, then we can make changes accordingly. The other thing is serum creatinine level, जिससे kidney का function हम assess करते हैं. So making sure कि your kidneys are functioning well, because a lot of patients of high blood pressure end up developing chronic kidney disease. So making sure that you don't develop chronic kidney disease or staying on top of it, for that आपको एक kidney function test order करेंगे जिसमें serum creatinine levels we check. ठीक है, so these levels are something that your doctors will order based depending on how often they feel it's necessary, they will do this on your follow-ups. So again, follow-ups रखना very important है. अपनी दवाई time पे लेना is very important. खुद self adjustment करना, please avoid any self adjustment. खुद दवाई रोकना, please avoid doing that. और अपने lifestyle changes, अपनी diet पे salt, pay attention to that. Pay attention to the potassium, pay attention to your weight, and pay attention to any other आपके जो risk factors है. अगर आपका smoking risk factor है या alcohol intake risk factor है, तो उस पे अगर आप थोड़ा ध्यान दें, तो you can prevent either developing hypertension or preventing the long term effects of hypertension. ठीक है? All right, next slide. ठीक है, that's us done for this webinar.
Thank you so much, Dr. Ranjeet, for sharing these useful tips with us and for making us understand about the myths that are prevalent related to hypertension and what are the management techniques or management tips that we should follow. So we are now opening the platform for question and answers. You can unmute yourself if you have any questions, and we would be happy to answer your question. आपके कोई भी सवाल है, आप अपने आप को unmute करके अपना सवाल पूछ सकते हैं. Would request to please share any personal questions related to your specific treatment over Zyla application itself, so that doctors आपकी बाकी history को देख करके आपको properly guide कर पाएं. On this platform, अगर आपके कोई भी ऐसे सवाल हैं जो आपको लगता है कि बाकी सबके लिए भी useful हो सकते हैं, आप जरूर पूछ सकते हैं. So please do not shy away and unmute yourself and ask the questions. Meanwhile, Dr. Ranjeet, we also have some questions that we received before the webinar. तो जैसा आपने बताया that lifestyle is very important to manage any type of chronic issues, be it diabetes, be it high blood pressure. So most of the time what happens is people just rely on lifestyle and do not start medicine even if it is advised by the doctor, or they keep delaying it. So is that the right approach?
No, preventing or not taking medications on time can, lead to stiffening of the arteries. It can lead to long-term organ damage. So, अगर आपको high blood pressure diagnosed हो गया है, तो दवाई start कर लेनी चाहिए. Your doctors have assessed that it is necessary कि आप दवाई, आपको दवाई की जरूरत है. So please make sure, if you have been prescribed a medication, that you take the medication. I know कि बहुत लोगों को दवाई start करने में initially बहुत inertia रहता है. They don't want to start. They want to find, ways to avoid getting on medication. But your doctors have assessed and found it necessary कि आपको दवाई की जरूरत है. Then please start your medication. You can make your lifestyle changes side by side. आप दवाई start करने के बाद भी आप, lifestyle changes कर सकते हैं. And you can make, and both of them together can help keep your blood pressure in control.
Thank you so much, Dr. Ranjeet, for answering that in detail. Another question related to, on the same lines, Dr. Ranjeet. So there are people who are on multiple medicines to manage high blood pressure due to other complications. So is there any way by which we can reduce medicines in the long term in the case of hypertension?
That depends case by case. अगर आप 3 medications पे हो और अगर आपको कम करना है, then it's better that you discuss it with your treating doctor, and they, you can set realistic goals कि okay, these are the things that I can do, whether it's reduce weight or cut back on smoking or reduce alcohol intake or exercise more. Sodium को बहुत tightly अगर आप अपनी diet को control कर सकते हैं, making sure that the other things are in line and making sure that your doctor is in the loop. Please do not try कि अगर आप 3 medicines पे हैं, आप उसको 2 खुद करने की कोशिश करें या 1 करने की कोशिश करें. That is not recommended. आप अपने doctor से बात करके, it depends case by case. Some people are able to reduce, but mostly generally when you are those medications, it's because you need, you need 3 medicines to have your blood pressure under control. So it's very hard, but not impossible.
Thank you so much, Dr. Ranjeet, for answering that. There's one question in the chat box that is somewhat related to someone's personal history, but just setting the context for everyone. So Dr. Ranjeet, very recently, or in in the newer generation, we have seen that people develop these chronic issues at a very early age, be it diabetes, be it hypertension. What is the main reason behind this? Is it our lifestyle or is it something else?
It's a combination. So, most of the studies have found that it's a combination of our lifestyle as well as the stress that we are under. Generally, बहुत आजकल, stress is something that is a very, very big risk factor, as well as obesity. There's an increase in childhood obesity, weight, poor lifestyle choices. All of these together, it's not just one reason, but all of these put together is the cause for developing high blood pressure at earlier ages.
Thank you so much, Dr. So, the experiences and the stories from your patient experience that you mentioned today, I can totally relate to it. So, my mother is a hypertensive patient, but she, once her BP gets into control, she then stops taking her medicine. And there is a condition of rebound hypertension, as you also mentioned. So, when I, asked her that what's the reason that she stops her medicine after a certain point of time, uh, her answer was that if I keep taking the medicines in the longer, it might affect my organs, specifically my kidney. Which, if we can understand belonging to the creatine, that it is the other way around. If she doesn't take the medicine, then high BP can definitely damage her kidneys, right? So this is the kind of the thinking that we as laymen have. So anything that we want to educate here on the platform, Dr. Gunji, to all the people? Dr. Gunji, I hope you are able to hear me.
Hey, hi. First of all, sorry, I just kept my calendar blocked for this call, but I just missed it after the office hour. So first thing I just want to know, will you be sharing recording or the information shared in the call with all the participants?
Yes, hi. Yes, the recording would be shared. Since you have also registered for the webinar, you would receive a recording
Yes.
of today's webinar so that you can,
Okay.
see it later on, or you can share it among your friends and family. Definitely.
Right.
And if you have any questions, you can surely share with us.
Yes, and because I missed the conversation, the crucial part of the webinar, but my question is, it might be irrelevant as well as now. So
No.
basically, I just wanted to know. See, hypertension. Okay, I understand. After certain condition, it will be diagnosed as hypertension, but before people reach out to the hypertension level, and as the doctor is mentioning, the lifestyle is one of the main reason. So what you recommend, so that if stress is part of our life, specifically for working women and people, so what do you recommend to at least not to reach up to the level of hypertension, so when you're emphasizing so much on lifestyle, so what change we can bring in?
So, like our presentation, we have gone over the lifestyle changes. The most effective one is making sure your weight is in control. कि आप regularly exercise करते हैं, and if you are smoking, if you partake in alcohol, making sure that that is something that those are things that you can definitely work on. Weight loss takes time, but if you can cut back on smoking, if you can cut back on alcohol intake, if you can control the salt in your diet, even if you're not hypertensive, making sure कि आपके खाने में salt कम है और आप बाहर खाना उतना नहीं खाते हो, because उसमें खाना generally oily salty रहता है. आप अगर packet food खाते हो, then the salt content in that is very high. Weight loss, diet and exercise, these are the three cornerstones of any lifestyle change. And if you can do that, keep those things under control, then you can prevent reaching the stage of hypertension. Hopefully that answered your question.
Yeah, it absolutely answered my question. And just one more thing, because most of the time hypertension, blood pressure is also connected with the weight. So is the thin people or with people with less weight have lesser chances of getting hypertension?
Yes and no. It's not that ki if you are thin, you will not develop hypertension. Agar unka stress zyada hai, if they are smoking, if their other habits are not right, that, you can still develop hypertension. But being obese is definitely a very important risk factor, right? Having a high BMI is a very important risk factor. But it's not ki agar aapka weight theek hai, but baki mere habits kharab hai, to I will not, just because my weight is under control, I can do all of these things and I will not develop hypertension. That's not the way it works. There's no exact science ki, this is the reason you have high blood pressure. Making agar aapka weight control mein hai, but you have other things that are, your lifestyle is bad, you have other addictions, getting those in control can prevent you from developing hypertension, right? If for you the major concern is losing weight and the rest is all fine, then you focus on losing weight. It isn't that key thin people don't develop hypertension. There are quite a few thin people who have hypertension and uncontrolled hypertension.
Yeah, understand. But with good lifestyle, they might be having lesser chances. What I understand.
Correct.
Yeah,
Correct.
if they
So
don't
if
have
you're
smoking and other habits.
correct. So if you're
Okay.
thin, if your lifestyle is good, then definitely chances of developing hypertension are lesser than someone who is not, whose weight is not under control and whose lifestyle is sedentary and who is smoking and drinking, right?
Absolutely. Thank you, doctor.
No
Thank you
problem.
so much, Ms. Nita. And thank you for asking all those questions, and hopefully we were able to answer that. So, yes, so coming to the end of this session today, thank you so much, Dr. Gunjit, for joining us on this platform and making us understand about these tips on World Hypertension Day today. Hopefully, everyone was able to take care of the tips that were shared today. I hope you were able to note down the points that were shared by Dr. Gunjit and you would be able to follow those. I hope you were able to debunk some of the myths that are revolving around us. So thank you so much for joining in. We'll keep doing more such informative webinars so that we can keep you up to date and aware about the common health related topics. If you have any questions that are still unanswered, please feel free to ask over the Xyla application, or you can also share with us over the email.